In the same vein, the Center for Brain and Mind, as you know, is collecting this huge amount of data across psychiatrically ill patients and their first-degree relatives, and the idea is that this is a longitudinal study looking at disease progression. What do you think that an Indian data set adds to, an international sort of collaborative effort? And as this project enters into its mature stages, you as director of ENIGMA, what words of caution or what words of advice would you have?
Yes, that's a great question. I'm really impressed by the Center for Brain and Mind. And one of the things that you have here that's absolutely unique is the range of expertise across all of the fields of brain health, mental health, psychiatry, neurology, genetics, fundamental neuroscience. I mean, there are people here working on removing from your genetic code the parts of your genetic code that cause diseases. So there are certain parts of your genetic code, as you know, that can produce tumors in the brain, tumors in other parts of the body, but also, and this is a natural phenomenon, cause disorders of brain development, increase the risk for mental health conditions. And being able to identify what it is in the genetic code that is tilting the scales towards someone getting a mental health condition. And we don't know whether in India or in Europe or in the US or in East Asia, we don't know whether the risk factors in the genome are the same or different. Now, we know something. We know that to the first degree of approximation, many of the same genetic deletions or duplications, or even single letter changes in the genetic code, they can affect our risk of things like Alzheimer's disease by an enormous amount. And so one of the examples is there's a variant in the genetic code in a gene called ApoE, and about 1/4 of people in the world have the bad version of this gene, and they're 3 times more likely to get Alzheimer's disease during their life. Now, it's interesting. In India, that gene is not as prevalent as in Europe. And I learned this because Sanjeev Jain, who was a speaker, he's been studying this, and he said, but the fact that it's not as prevalent doesn't mean that there aren't other genes that are equally important. And if we just went with a westernized agenda of what factors are important, I mean, it might be important in India, but there might be other ones. Or it could be that it is equally dangerous, but there might be some other modifiers that are particularly important here. So I think the field has moved a little bit towards epidemiology, where people are looking at environmental factors. What is the effect on mental health of good education, good access to healthcare, a family that is socially supportive? I mean, very often someone with a mental health condition, if they're in a family environment that is understanding, it's not a taboo to talk about it. It's something where there's access to help and maybe professional guidance. People with mental health conditions can function very effectively in society, achieve their goals, achieve their own personal interests. But it's interesting to know what matters. So if the main thing is a good social network, access to healthcare, access to good medications, then that is what we should do. If in a different culture, maybe it's education or something in the environment. There are many parts of the world where pollution is very high. And for people with respiratory illnesses, pollution is very important. So, I'll tell you a story about this. One of the groups in ENIGMA is in Mongolia. And Mongolia is very different than India, very different than the United States. And when I went there, I said, well, what are the major health issues in Mongolia? And they said, well, it's very cold in Mongolia. And in the winter, the children live in yurts. They're like huts that are in the desert. And we burn coal fires. And the coal fire emits, smoke. And a lot of the smoke from the coal fire gets into the children's lungs, and we see a lot of children for respiratory illnesses. So they would say, in Mongolia, we're not as interested in mental health. We're interested in it a little bit, but we're interested in respiratory illness. So I think it's very important to take a somewhat global perspective for these medical studies. It could be that in one culture, something that is tremendously important hasn't been looked at. And it could be a genetic aspect of health. It could be an environmental aspect of health, or even social. I mean, there may be something in the access to healthcare or environment that can be remedied, and it would make the world of difference, even if that isn't an issue elsewhere in the world.
As you mentioned in your talk today, science is a great way of bridging cultures.
Yes, 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 yes.
Also, I was wondering, I mean, India is now the most populous country in the world, and we have a rapidly growing economy. But we still have a very heterogeneous population. While building these large cohort data sets, do we overlook sometimes these differences, or how do we think about that? How do we think about sort of homogenizing the data that we see, both here and globally?
Yes, so India has a lot of unique aspects that are not found anywhere else in the world. And I mean, you've mentioned this, the diversity of language, the diversity of education, even the social and cultural differences across. I mean, I think of India as one country, and I mean, anyone who lives there knows that there's just immense variety. It is a huge opportunity for medical research and discovery, and not just the talents of the people, but the ability to survey medical information at this scale with this variety. And I'll give you one example. So one of the popular medical data sets that is used a huge amount is the UK Biobank. And when the UK Biobank is based in Britain, where I grew up, when it was first announced, I was a little bit annoyed about it because we were building data sets from around the world, and now there was this big UK data set. Oh no, competition, there's going to be another big data set. And I looked at it over the years, and it grew as a project. It was tremendously successful. But there's a limitation, and the limitation is, suppose, and it alludes to what we were talking about earlier, suppose we find that in the UK Biobank, people that take statins, which is a heart medication, people who take statins have a lower incidence of heart attack, and in the brain, a stroke, which is a vascular incident in the brain. If I read a study here in India about this, I would very naturally say, well, in the UK there are plenty of Indian people. In the north of England where I grew up, there were Indian communities, but maybe the Indian people in Britain don't have the same circumstances as the people here, and maybe they do, maybe they don't, but I don't know. I'm reading this. How am I to know whether to take statins? And, you know, the doctor would say, well, it's a well-done study. It was done in 500,000 people. And the patient would say, but these are not people like me. They might be, but we need to verify this. So I think, to your point, the creation of biobanks in India, I mean, here by the Center for Brain and Mind, which has a particular interest in brain conditions and mental health conditions, but then also more broadly across India in terms of epidemiology, the potential to see things that no other person has seen before is greater than anywhere else. And I genuinely believe this. I think it's greater than anywhere else on Earth, because the scientific potential in India, together with the diversity of information that can be gathered, will discover things that haven't been seen. And they cannot be discovered anywhere else because the information isn't there.
Thank you for that. And I'd like to close with like slightly broader question. Well, not close, two questions. One is, if you were a budding researcher coming up in neuroscience today, what would, let's say, the top 3 questions that would interest you in neuroscience? And as a person who's been in neuroscience research for so long, what do you think the next decade is going to look like?
Yes.
Is it neuroimaging and solving brain disorder?
I think one thing for new students and people interested in neuroscience is it's a tremendously welcoming community. Now, if you were to stand outside a university as, you know, maybe a 16 or 17-year-old, and you say, well, I think I know what happens in there. Am I going to be able to, you know, have the skills to learn this? And I mean, you know, maybe they're a student considering neuroscience or life sciences in college. nobody comes with an understanding of these things. And if you have, I mean, I think a couple of things are important. If you have the curiosity, a willingness to learn, an openness to new ideas, you'll find academic people very receptive. I mean, they haven't solved it. I mean, all the academic people, however talented, have not solved these problems, so they can't be self-important about this. So I think neuroscience in particular is very welcoming because it's not a single discipline. It's not like mathematics. It isn't even like ancient languages where it's a very unified set of things that you need to understand. You know, people come with an interest in computer science and they can contribute to, you know, analyzing the data, maybe creating AI tools to diagnose diseases, maybe even making computational models of how parts of the brain interact. People might come with a medical interest, like they might say, well, I have this disease in my family, I want to contribute to solving it and learning about that. So there's a clinical motivation. And then there's just this natural curiosity about the mind. Many neuroscientists who are interested in how the brain works are interested in emotion or memory or you know, how do we understand language? I mean, you know, we're having a conversation. What is the brain doing to process those sounds and make them into concepts and, you know, think of a sensible reply? And these are all mysteries within our reach. I mean, they're not, in our lifetime, things that I think will stay unsolved. I think people will solve these things. And that's a tremendously exciting opportunity. So I think just to reassure people going into this field, you don't need to know things about this yet. Just bring a natural curiosity and open-mindedness. And there are people able to train you in these things. I mean, it's a very long journey. I mean, there are people that can help in every possible aspect of this. And if it's not for you, the time won't have been wasted. You can do something else equipped with a knowledge of the brain. Your second question is a much more difficult one. So you know, knowing what areas will be most promising in future years is a little tricky. I mean, I'll come from my own slightly prejudiced perspective because I like brain imaging. I think brain imaging has a lot to offer because it is used today to diagnose disease. So we want to improve it. We'd like to make the imaging better. We'd like to make it accessible to more people. And we'd like to make it useful to help with both diagnosis and assessment of treatment. But at the other end of neuroscience, I mean, there are people looking at DNA, looking at the genetic code. There are people here at CBM, many labs doing this, that are working with stem cells. So stem cells, maybe people don't know about this. So stem cells are a type of cell that is able to turn into a neuron, a brain cell, an astrocyte, one of these helper cells. It can turn into muscle, into heart cells. And scientists today are able to introduce changes in these cells that can either make them function better, they can eliminate a genetic anomaly, they can become helper cells that can be introduced in people with cancer. I mean, stem cells are used as a treatment in oncology. And also, a bit more speculatively, in people with degenerative diseases of the brain that currently we don't know how to treat, there's interest in stem cells being, in a sense, programmed to rewire and reconnect parts of the brain that can't currently function. So I think it's almost like this whole vast landscape of discovery is ahead of us. And much like someone visiting a new city, I mean, you'll find, you know, this infinite landscape ahead of you that you're able to, you know, not just explore but enhance and maybe contribute to in many different ways.
You mentioned crowdsourcing helping neuroscience advance. I wanted to understand a bit more about that a little.
Yeah, so crowdsourcing is a bit of a funny word, and it's sometimes used in different contexts. And one that will be familiar to you, and although it's not a very nice example, is during the pandemic. So during the pandemic, it was extremely important to know where the virus had spread, how many cases there were, and it was a very rapidly evolving situation. So in that context, crowdsourcing used the internet, and you were able to very quickly build up a picture of where in the world the disease was getting worse, where it was getting better, and not just that, where treatments were having an effect. So that, to me, is the most clear example of crowdsourcing, because the whole world was interested in the same problem. Now, in a slightly more benign setting, let's say you and I had a question about the brain. So we'll think of a particular disease. So we could say, let's think of a real question that people have about ENIGMA. Bipolar disorder. So bipolar disorder is a psychiatric condition which is very perplexing, where people are profoundly depressed, but then they have manic episodes. They might be extremely excited, but not just excited in a good way. They might spend a lot of money or be very worked up and get into an accident. So in ENIGMA, we have a working group that studies bipolar disorder. And there's a whole lot of medications for bipolar disorder. So one of them is called lithium. And lithium makes you very tired. But there are some newer medicines. One's called valproate. And there are antipsychotics, antidepressants. So a crowdsourcing project would be the following. So you and I could say, well, I want to know which of these medications diminish the effect of bipolar in the brain. But I don't have the resources to collect data on this myself. Does anybody else have any relevant information on this? So what we do in ENIGMA, and it's a whole lot of fun, is anybody in the world, you don't have to be an ENIGMA, you could be an interested scientist, anyone who's qualified. And so I'd like to study how these medications for bipolar affect the brain, not just the function of the brain, but the clinical outcomes. Who would like to join in? Is there anyone with relevant data? And you would get people from Europe, people from India, people from Australia, South Africa, East Asia, maybe Japan, that might have brain images from 500 patients. And the people in Japan might have been treated with lithium. And the people in the UK, they might say, well, we don't use lithium, we use a different medication. And then the people in the US might say, well, we have a lot of patients that have had all three medications. What about that? So the crowdsourcing would work in the following way. The person who'd suggested the project would then have access to all this data, and they might be a computer scientist, or they might have a skill in data analytics. They don't need to have any clinical skills. And their only obligation would be to report back to the group what they found. So they would go away maybe 9 months, 12 months, whatever it takes, and they could get help from the other people with the data. So that's a very unusual project because it doesn't just involve downloading some data. You'd have to see who there is with relevant data. And there are hundreds and hundreds of these projects going on. I mean, some of them are looking at the function of the brain in people who are recovering from addiction, people that use methamphetamine or cannabis or cocaine. Do people that stop using these drugs recover their brain function? And so, although it's a little odd to say this is crowdsourcing, there's a crowd out there. I don't know if they'd like to be called a crowd. They're a crowd of people. Who cares? It's fine. But the crowd of scientists would join in. And I suppose the person suggesting the project, I mean, they could be a crowd as well. I mean, they could be a group of people who are interested in a particular question. And if there's something that ENIGMA doesn't do today, they could get in touch. They could say, we'd like to have a group. I'll tell you a good example. So Dr. John, who's a neurologist at NIMHANS, he said, in India we have a condition, it's found in other parts of the world, but we treat it a lot, called catatonia. And catatonia is a complete rigidity of the body. But he said, fortunately it's treatable. There's an anxiolytic treatment called lorazepam. It's a tranquilizer. And he said, we don't really understand this, but a person that is catatonic and is immobile, if we give them this tranquilizer, they completely recover. They can move, they can talk, they can... And he said, we discovered this, it's great, it's a very powerful treatment, but it's very strange. Why would a tranquilizer... And there are some examples in neuroscience where a stimulant is good at treating attention deficit disorder. I mean, the brain doesn't always work in one direction. You can have a neuron, as you know, that's inhibitory, that is turned on and then it stops the problem. So he said, why don't we have an ENIGMA group on catatonia? So I'll have dinner with him this evening. And at dinner this evening, we'll discuss whether we can do this. So I think, this is just an example of the many ways where, a person can come into the field with a question and there's a lot of prospects for it to be answered. And then again, as you said earlier, for more junior people who are thinking, is there anything in this that I can contribute to? I mean, there are many avenues.
There are many avenues, indeed. And the last question I have for you is, what does an ideal policy framework look like for you, both from a governmental perspective as well as from, let's say, pharma companies and private sector perspective, given that the burden of mental health is this huge?
Yes, well, that's a very difficult question. So the first area where there needs to be change, and I think through Manotsava, your festival, you're catalyzing this, is that even if all the medical conditions that were in the world were solved, but there was a taboo around the condition, it wouldn't fix it because people wouldn't seek help. They wouldn't even know the available treatments that could have value to them. So there's a scientific element and a public and social element. And until mental health is prioritized at a national level, and until scientific awareness of these things is prioritized at a national level, all of the developments will go without being capitalized on or being made accessible to everyone. So I think there's some cause for optimism. I mean, let's just give the Manotsava as a good example. That is a community, and I was new to it, I don't have a part in it, I'm just an observer, where members of the public came and learned about addiction, dementia, depression, trauma, I mean, any number of things. And I'm supposed to be an expert in this. Or you held a panel on psychedelics. So psychedelics are, they're a type of drug that has had a rather negative impression because they're often abused. But at very, very tiny doses, they've been found to be therapeutically effective in the very recent past for a range of conditions, including obsessive compulsive disorder, even major depression. So I think even having a dialogue in the community where people can learn about these things, and a person that went to your meeting, let's say 6,000 people went to your meeting, they'll meet in the coming days hundreds of other people, and this information propagates and the optimism propagates and the network of connections where people can get help is reinforced. So it's a sort of interesting thing, whether at a federal level or a policy level, these things can be changed. And there are two philosophies. One is there's an individual responsibility to try, each of us to promote and connect other people, which we do. And then at a more public health level, I mean, there's things where we can engage maybe politicians, people that have an interest in coordinating policy, to prioritize these public health programs.
Thank you, Paul, so much for your opinions, your views, and this was a wonderful discussion. With that, I'd like to sign off of our second version of the podcast series by the Center for Brain and Mind. I'm Shriya Palchaduri. I'm the Associate Director of External Engagements at the CBM. Thank you for listening, and goodbye.